Hi, my name is Elise. I'm a healthcare chaplain and advanced care planning coordinator, and these are my top 10 tips for visiting someone in the hospital, part 2. Number 6, don't be an expert. First of all, don't be a medical expert. Don't try to give them medical advice or tell them what worked for this person or that person, or try to guess what their diagnosis might be or their prognosis might be. Even if you feel like you have similar experience, their clinical situation may be a lot different from yours, and it's typically not helpful for you to do that. Definitely don't tell your own medical horror stories, your own troubles, your bad experience with this doctor or that hospital. Not a good idea. If the person needs help getting up, going to the bathroom, also don't be an expert. It's better to ask for help from the nurse's aide or the nurse rather than trying to help them yourself, especially if they are at risk for falling. And don't be an expert in life either. So don't try to solve all their problems. Don't try to correct their beliefs or their feelings. That goes back to the last tip, which was about listening. Number 7, maintain privacy and confidentiality. So if the doctor comes in to talk to the person while you're there, it's best to offer to leave, at least step away while the doctor is there, or to cut your visit short and leave, because there may be sensitive things they need to discuss with their doctor. Maybe there are things that the doctor needs to disclose to them that maybe they're not ready to disclose to everybody, or there may be just parts of their illness that they want to keep private and confidential. So be courteous and just offer to leave, and if they want you to stay for any reason, they can tell you. Same if they're being offered a meal, if it's mealtime. Sometimes people want to eat in private. It can be a little awkward eating in front of someone, so just offer to leave or to step away while they're eating. And if they do disclose things to you, if they tell you information about their illness or injury, or if they talk to you about their feelings or personal things, don't disclose that information to other people unless they've told you that it's okay for you to do that, and let them know that you'll keep it confidential. The exception, of course, is if they're talking about harming themselves, planning to harm themselves or somebody else. Then you can tell the care plan team. Number 8, when offering prayer or another religious or spiritual practice, give people an out. So if you're somebody who prays, or if you have another meaningful spiritual practice that you share with the person that you're visiting, or you feel like they would be receptive to you offering a spiritual or religious ritual or practice, then by all means, offer to pray, to read from scripture, or whatever it is that you feel would be comforting or helpful to that person. But don't assume that they will want it. So always give them an out when you're offering. There are many reasons why someone, even if they're the same faith as you, might turn down an offer to have a spiritual practice shared with them. Maybe they're really tired. Maybe they are feeling more private. It can be intimate to have somebody else praying with you. Not everybody wants that. Or maybe they've had 3-4 people already come by and say a prayer, and they've had their fill, of people praying with them. So don't take it personally. There may be another reason why they don't want it right now. One way that I like to offer prayer, for instance, with someone, while making it okay for them to say no, is to say, would you like me to pray with you right now? Or would you prefer that I pray for you when I'm thinking about you? And a lot of times people will say, just pray for me when you're thinking about me later, which makes it a lot less awkward for them to say no. Number 9 is follow through. Be careful with your words. Sometimes we make a lot of promises when we're leaving that we don't always intend to follow through, like I'll come by and see you again tomorrow, or I'll check on this or that for you, or I'll help your family with such and such. It's best not to make a lot of promises if you're not sure you can keep. If you do offer to do something, do your best to follow through. Also, if the person you're visiting has told you about a need or a concern that they have that is not being addressed by the hospital, you can let the care team know if you have a concern or a need that you feel like needs to be addressed. Number 10, call the chaplain if you need more help. Maybe as you walk away from the visit, you're feeling concerned about that person that you just visited. You feel like they could use more support emotionally or spiritually, or they may have needs that you're not quite sure how to address. Maybe there are ethical concerns that you have about the care that they're receiving, or maybe you yourself need some support as a caregiver, as a loved one, as a friend, somebody who cares about that person. You're having a tough time, you're grieving, you're not sure how to accompany them, and you need somebody to talk to besides the person that you just visited. Chaplains are great patient advocates. They're highly trained to support people in their hospital and their caregivers, and they can be a really good resource for you. So these were my top 10 tips. Let me know if I missed anything in the comments.